When seeing the research that the recent scholars are doing, I just see the boundaries continue to be pushed further and further.
I always come away from the annual meeting filled with hope. What can be more hopeful than exciting, brilliant young minds working on cutting-edge issues? And as we build this field, we fully expect that these are going to be the future leaders that help us build population health science.
My research is about several things. So I do environmental epidemiology using electronic health records. That takes into account where people live and the types of environmental exposures that they're getting. And so some things I've worked on include whether people living near large animal feeding operations are at risk for antibiotic-resistant infections. And then more recently, I've been looking at people living near fracking in Pennsylvania and birth outcomes.
My research was looking at the mortality toll of the U.S. obesity epidemic.
My research is on place and how place matters for health. I focus primarily on cardiovascular disease as many of its risk factors. So for example, we focus on Life Simple 7, which is focusing on things like diet and physical activity and smoking. Those kinds of things are highly structured by opportunities and access and resources. So I look at the ways in which place shapes health behaviors and other health factors that cause heart disease.
So I'm very interested in the determinants of health at older age. So I integrate demographic and epidemiologic perspectives to understand the life course determinants of being healthy and unhealthy in old age.
I do research on how the social environment affects health, mostly looking at socioeconomic status, education, and income, and how it relates to health outcomes.
I study how neighborhoods have changed since the height of the civil rights movement, so how racial segregation and class segregation have changed, and then the consequences of that on health and health outcomes for blacks and whites in the United States.
I study mortality selection, which is the problem that our measurements of inequality are understated because we only measure the people who live long enough to be counted.
My research, broadly speaking, focuses on racial and ethnic differences in physical and mental health, with a particular focus on comorbidity, especially the co-occurrence of physical and psychiatric health problems.
My research early on as a graduate student wasn't focused on the kind of traditional areas of what psychology would consider its turf, in a sense. What I was really interested in was taking many of the things that we've learned through psychological science about how people make decisions, both cognitively, how they think about them, as well as from the behavioral point of view. What are the things that people need to do to have a different experience in making choices about their care? And I was interested in taking that which we had learned from psychology, from behavioral science, and applying that to a problem in healthcare and advancing how we deliver care.
My research focused on bureaucratic collaboration, trying to understand when agencies would work together to share problems that cross boundaries.
The Center for Medicare and Medicaid Innovation was created by the Affordable Care Act to test innovative payment and service delivery models for Medicare and Medicaid beneficiaries. So what that means is that, particularly for our group, which is focused on prevention and population health, we are testing ways that through the healthcare insurance and delivery system, we can improve population health.
So my research applies the growing field of network science to try to understand gun violence in U.S. cities. So what I try to do is use models that you would use in standard epidemiological research to treat gun violence like a contagious disease, not sort of metaphorically, but literally, how it gets transmitted from person to person, how it spreads within small networks, and then ultimately to see how we can leverage that information for violence prevention.
My research during the time and still is really on the intersection of communication, politics, and policy. I think a major conclusion I've reached in my research is that public health is inherently political.